Vanakkam. Hello. Welcome to the session on grassroots actions in refugee context. I'm Jeevi and I'm your session chair. Before getting started, I would like to acknowledge the traditional custodians of the land where I am, which is Wurundjeri country, and the traditional custodians of the land wherever you are, and pay my respect to the indigenous elders, past, present, and emerging, for their wisdom and their resistance against oppression. I would also like to take this moment to acknowledge the plight of refugees in detention centers, camps, on the sea and land, here in Australia and across the world. A couple of housekeeping announcements. So please use the Q&A function on the Delegate Connect conference platform. So there is an oval button says ask a question. So use that to post your questions to all the panelists. And I encourage you to use the chat box for real-time feedback. I'll keep an eye on both the chat box and the Q&A function. If you're active on social media, please share your comments and thoughts, but do not forget to use hashtag 2021HCL and hashtag #WhoAreTheHumanitarians. We have 3 presentations. Each presentation will be followed by 1 or 2 questions. Depends on how it goes. But the main Q&A and panel discussion will be held at the end of all the presentations. Let's not waste any more time. Our first presenters are Pankaj, Kumar, and Muhammad Abdul Rahman. They'll be talking about EKOTA, changing the way we work in humanitarian response. Pankaj Kumar is the country director of Christian Aid Bangladesh. He has been an international development and humanitarian professional for more than 20 years, playing a leading role in Bangladesh, Ethiopia, Liberia, Nepal, and Zambia. Muhammad Abdul Rahman is the program director of RDRS Bangladesh, a Bangladeshi NGO. He has more than 32 years of work experience in diverse capacities and has extensive experience conducting impact evaluation of development and humanitarian programs. Welcome, Pankaj and Muhammad. The mic is yours.
Thank you, JB. Thank you very much for your nice introduction. And I welcome all the viewers and listeners to this presentation. Let me inform you at the initial stage that we do not have any PowerPoint presentation. And I understand all the listeners and viewers, you are watching us. Unfortunately, COVID did not allow us to watch you. We cannot see the viewers. So welcome once again to our presentation. We'll be speaking orally. And as mentioned by the chair, we'll be talking about a unique consortium in Bangladesh who are working together to address the Rohingya crisis in Bangladesh. So let me introduce this consortium first. We call it EKOTA. This is a Bangla word of our consortium name. In English, you can call it Unity. So EKOTA is a consortium of 3 organizations in Bangladesh, namely RDRS Bangladesh. We have Caritas Bangladesh in this consortium and Christian Aid Bangladesh. So these are the 3 organizations we work together in a different way to respond to the Rohingya crisis in Bangladesh. The unique feature of this consortium is basically that we run this consortium in a shared leadership that is very unique in our consortium. And the other main aspect of this consortium is we focus mostly on the localization. We believe the localization, we practice it, we promote it, and we preach this localization approach in all our activities in this Rohingya crisis project. So the funding of EKOTA comes from DFAT. It's the Department of Foreign Affairs and Trade through Australian Humanitarian Partnership. So the response, the format of response of DFAT in this area is multi-layered. What I want to mean is that Akota is a consortium within a bigger consortium. So let me explain it a little bit more. Akota is a consortium of 3 Bangladeshi organizations, where one organization is international organization, Christian Aid. But AHP is the bigger consortium. So what we say, in order to make this clear, that it's a small consortium within a bigger consortium. So I think I made it clear. So the AHP partners, there are 6 organizations, in fact: Save the Children, and We Have Care, World Vision, Plan International, Oxfam, and Can Do. So these are the 6 organizations under AHP consortium. So let me take this opportunity to introduce Can Do a little bit more with the viewers and listeners. Can Do is an Australian-based church agencies organization, and they mainly respond for disaster operations in Australia. But the localization is in the forefront of all their activities. They believe in locally led responses, and they work with 8 organizations and their partner organizations within Australia. So we can say, basically, Akota is the Bangladeshi counterpart of Australian-based Can Do consortium. And Can Do is a part of AHP, the Australian Humanitarian Partnership Program, who is responding to the Rohingya crisis in Bangladesh through Akota consortium. So that is in brief about Can Do. Now let me take this opportunity to talk a little bit about these 3 organizations of Akota consortium. RDRS Bangladesh basically started just after the liberation war of Bangladesh in 1971. So initially it was an international organization, but later on in 1997, we became a completely national organization. Caritas Bangladesh, which is also a national organization, but they have association with international network, Caritas International. But Christian Aid is totally an international organization. But what I would like to share with all of you here is that although Christian Aid is an international organization, but here in the Rohingya crisis, in the Rohingya response, they work through a Bangladeshi local organization, which is known as DSK. It's a Bengali word, might be difficult to remember, Dustho Shastho Kendro. So I will be talking about DSK. I will never say the Bengali Dustho Shastho Kendro. And again, interestingly, you will be happy to know that though RDRS Bangladesh is a Bangladeshi organization, is a national organization, we also work under this project with another local organization, which is known as Green Voice. So these are basically, although we said 3 organizations, but in other words, you can say it's a consortium of 5 organizations, 3 main organizations and 2 other local organizations. And all these organizations are Bangladeshi organizations. Now, let me take this opportunity to share with all of you how Akota is working differently. As I said initially, that we work differently in the humanitarian sector. Basically, what we are trying to do through this consortium, we are trying to shifting the power relations to the local NGOs, having local and international NGOs in a level playing field. So there is a level playing field for both national and international organizations. So you might be surprising and interesting to know how have we done this. So let me put some light on these issues, how we have achieved or how we are trying to do this. The basic principle we follow here. We say all partners are equal. It is based on true belief of partnership, not the so-called partnership where one consider another one as contractor or sub-recipient. This partnership is real partnership. It is based on mutual trust and relationship. And how we are implementing this? Basically, we have formed or established an independent local coordination unit to run the program on the ground. So this unit is reportable to Dhaka level steering committee, which is headed by the heads of these three organizations. But interestingly, the idea that we have introduced here, that this hosting of this unit will be rotational basis. So what I mean that this unit will not be hosted by one organization for the whole project period. This will go on a rotational basis. For instance, if Christian Aid is hosting this unit for first year, Caritas will take over in the second year, and RDRS Bangladesh will take over in the third year. So that's how basically on a rotational basis, this unit will be hosted by three organizations, which is very interesting. And the second, as I mentioned before, localization is at the forefront of all our interventions. Well, the bigger consortium, as I mentioned before, the 6 organizations, AHP, under AHP, which is led by a high-level steering committee. They also focus on the localization aspect to better meet the needs of the affected population in the host communities and also in the Rohingya camps. Well, now I will focus more on how we are implementing. Basically, the consortium has already introduced very pragmatic, very down-to-earth, and very practical initiative for localization. We engage and empower through this consortium the local organizations to take charge of everything. What I mean, it is basically not Can Do Australia who is guiding us or imposing something or directing something to Akota. Basically, it is the Akota members, the local actors, the national actors. We sit together, we decide, we go to the people, we listen to them, we sit together and design the project. We identify the needs jointly, we design the projects jointly, we implement the projects, we track the progress jointly. So in other words, we can say that this is the co-creation of these 3 or 5 organizations together. We do everything together. It's not one organization or not 2 organizations who is deciding everything. And the budget we also share with each other. In traditional partnership, you will see that budget is not being shared with other partners, but here we share our budget and ensure the overhead cost of the local organizations as well. You will be interested to know, and you will be also happy to know that we are the only consortium under this ASP consortium where majority of the funding, which is more than 70% funding, is going through the local NGOs, which is fantastic, I would say, because in most cases, the direct funding to the implementers are very less. But here in this consortium, as I said, that we are focusing on the localization. So most of the funding, 70%, is going through this Ekota consortium in collaboration with international partners. Means I refer to Can Do in Australia. So if I compare this with the previous practices in Bangladesh in humanitarian response sector, you will find a totally difference. We are doing it totally differently because in early days, in humanitarian crisis situation, we saw most of the funding was channeled by the international NGOs. And they were the designer of the program, they were the implementers. They gave this funding, a portion of this funding to the local actors. And they asked the local actors or national NGOs just to implement. So basically the local actors or the national NGOs did not have any major role in designing or decision-making stage. This is still, I would say, this is still the case in most of the scenarios in Cox's Bazar, except Akota. Basically, we are doing it totally in a different way. Well, now most of the funding is going to the local partners. What does it mean? It means that we can go for bigger coverage because the operational cost is very low. The admin cost is also very low. The management cost is very low. So we can do more with less resources, because the salary structure is also, for the national staffs, it is low. Because in Akota, most of the staff members, they are Bangladeshi. So our cost is low. And what we can do, because we understand the local context better than the outsiders, because there is the English saying, I learned it in my student life, the wearer best knows where the shoe pinches. So the local context, the local organization, they understand better than anyone else or any outsiders. So what it gives us, we understand the local context better, and based on the local context, it is not supply driven. Initially, it was supply driven. Now we are following the demand driven approach. We understand it better, so we can design the program in a better way, we can deliver it in a better way, and we can achieve the results in a better way. Well, so you see, in early days, the relationship was basically the contractor and donor, or partners and contractor. They were given certain amount and asked to do job. But now it is partners relationship. It's an equal footing, in the partnership. And we listen to each other. We give equal importance to each other's view. So we work together. That is the total shift. Well, these three organizations, we have significant experience in working throughout the Bangladesh, because we have office location all over the country, and we have extensive reaches, and we have each of the organization, I would say, we have more than 50 years of work experience in Bangladesh. As I said, that we started after the liberation war in 71. Caritas Bangladesh also started before the liberation, and Christian Aid also started their activities after the liberation war. So each of the organization has vast experience in working and addressing the local needs. Well, how we are doing it? We build the capacity of the local organizations, and they feel confident. When you involve, when they can participate in the decision-making table, when their voice is heard, they feel it is their program. It is feel the belongingness, they feel the belongingness, the ownership of the program, so we can better implement the program and we can achieve the better results, and we can go for sustainability in a better way. Well, still, we cannot claim that we have all the expertise, though we have the technical expert in every sector. For instance, someone is expert in livelihood sector, someone has expertise in DRR, someone has expertise in health. So what you do, there might be lack of efficiency or lack of capacity in a particular area. Then basically we bank on others' experience, so that we can get the job done. Well, that's in brief about my part. Now I would like to go to Pankaj Kumar, who is also the country director of Christian Aid, and he will put light on some other very important aspects of this Akota consortium, about the lessons, about the challenges, and about the future of this funding, all these things. Thank you for your patience hearing. I will come back once again during the Q&A session. Now I would like to hand over to Pankaj Kumar. Over.
Thank you. As my name is Pankaj, as has been introduced, so I work as a country director for Christian Aid in Bangladesh. So what have we learned out of this kind of models? So one of the learning from this model is that adapting and learning from each other. We have been continually learning as we are going ahead, and as we are adapting, particularly in the context of COVID. The COVID has actually brought into forefront the local NGOs to implement and take a lead, and it's more important that the power shift with the local partners, and they are the one who takes the decision. Another learning is that these kind of processes take some time, and when we talk about processes, it needs some kind of an oversight from them. And as local NGOs work together and more power is given to them, this commitment will reduce. At the same time, we are learning from each other, and it's a real issue of capacity building and learning from each other and helping for the poor or the marginalized people of the Rohingya response or the refugee community. community. As we know that, there is so much of capacity within Bangladesh context. It's a land full of NGOs that, it's important that the local NGOs take forefront, and it also brings into account the sending the local capacity to that. Now, one of the other things which we are talking about as local as much as possible, but also some kind of an involvement with the international agencies. So what does it mean in practical sense? In practical sense, it means that partners take a lead on designing the program. The international actors, they provide technical supports, and sometimes in terms of capacity building, strengthening, and doing the designing of the program. And in the future, this may really help us, because the role of international partners would be to make sure that they ensure the quality control or the quality assurance of the implementation. We have seen that quite often in emergency, the time is very limited and the local NGOs cannot prepare the proposal very fast. So it is where the international agencies or the international expertise come. At the end of the day, what we build is to build up the best results for the beneficiaries. And this is the way of working and producing most cost-effective response, at the same time, culturally appropriate response for the affected population. Now, how is this consortium changing the way things are done? Now, decisions, as we had said, decisions are not taken by an INGO, but rather they are taken by a consortium approach, by a governance system within the consortium. More funding is directly allocated to things, and we are working towards way where we are very respectful to the local communities in terms of their languages, understanding their cultural experiences. An example of this is communicating in Rohingya languages with the communities through Rohingya volunteers or the faith-based leaders, etc. So what do we see the future of aid? The future of aid in this kind of a context, we say, role of international NGOs in future will be much more limited, where the locals will take up the charge of it. It could also mean change in shifting of the power from the international to local, working together in the country to produce the best outcomes, building capacity of each other and learning from each other, reducing implementation costs and using capacity across organizations, and more localized response. Thank you very much. These were the points from my side. We would be very happy to hear any comments on that. Thank you.